Usually get this question where people ask me, Tebogo, how do you prepare for your visit, your monitoring visit? How do you go about preparing for all these visits that you go about? What do you do, right? So I'm just gonna go through a couple of things that I do for a visit, where I'm preparing for a site visit. Let's say a routine monitoring visit. Yeah. So what I do usually is I start by running reports. These reports will include what I would need to do in terms of SDV, SDR, looking at the action items that I have already opened from the previous visit, going through all the action items that I've already opened and what can be closed remotely and what cannot be closed remotely and what can be closed at the site. First thing. Second thing is depends on what the stage of the study is. Are we going through a database log? Are we going through a routine monitoring visit where we have a backlog of SDV or SDR? What's going on in the site? And depending on that answer to that question, would prioritize as to what I look at when I get to site. My site visits usually include pharmacy visits, usually include lab visits, usually include a walk around the site to show me as to how do the participants go through certain visits and what do they perform at those certain visits. Usually also includes emergency trolley, which is occasional as well, not on a regular basis, but emergency trolley as well. It includes checking the lab kits, if there's any expired lab kits or if there's any expired IP. If there is a visit where I'm doing IP returns, then I'll go through and set up initially the people who's gonna come and pick up the IP, and then from there make sure that when I'm at site I do my IP returns, and yeah, documentation, ISF, reviews, review as well would be included in that. If there's no database log. So there's a lot of things that go into preparing for a visit. So like I said, I would run the reports for SDV, SDR, looking at as to what is missing, what is not missing, what should be dealt with by the site, what shouldn't be dealt with by the site. I'd run a report for looking at adverse events, what adverse events have been raised from the previous visit, and what am I gonna be reviewing during this current visit that I'm going to. Action items, as I said, and also looking at my monitoring report, the template of my monitoring report, and looking at all the things that would need to be addressed at that specific visit, based on my monitoring report and also my monitoring plan and the protocol. So that is my thinking behind it. I would send also a confirmation letter with all the things that I'm going to be looking at and who I would like to meet when I'm at site. That is very important because people would need to schedule and plan to give you time when you're at site. So you need to let them know in advance that no, I'm going to be meeting with the pharmacist or I'm going to be meeting with the lab supervisor. So please just make provisions for me to meet that person when I'm at site, right? So that is also one of the things that I do. Yeah, and when I get to site, greet everyone from the reception to the study coordinator, have a meeting, a debrief meeting, a slight debrief meeting with the study coordinator of my visit, what I plan for the visit, what am I going to be looking at, what will be important for me, what files should they bring to me, and who will I meet when I'm at the visit. That is very important because you're setting it out for them to know as to when you need certain things, when you don't need certain things, how you'd go about your visit, so that they're not confused as well when you ask for things and they're busy with other things. Yes, so that's me in terms of planning for a visit. I think people do it differently. and you need to understand as to who you're working with and how they're working, their ways of working in terms of planning for a visit. But it's usually running reports, pre-planning, putting things in order before you even get to site. When you get to site, you need work to be done because you have a limited time at site. So you need work to be done, and you need a lot to be done within a very short space of time. So you need to plan properly, and your time management comes into effect. But I'm gonna throw in a spanner here to say that there are times where things don't go as you planned, and you have to be ready to pivot and to change your plan at the site. Might find that there's something that urgently needs to be looked at, or the site has found something, or there's a deviation that you need to investigate further. Those things are things that you need to take into account when you're at site. It will not be rosy all the time, but it's something that you need to think about when you go to site, that you know what, things might not go the way I've planned them, and I might have to change. But the most important thing when you change is letting everybody know, from your trial manager to the PI to the study coordinator, that no, I think I'm going to be looking at this based on these reasons. Can we have a conversation? Or if there's retraining that is needed, can we have retraining for these specific people? So in my thinking is that you set up as a CRA, you set up as to how you're going to look at your visit. But what I'd always suggest is start with action items, adverse events, newly signed informed consents, and then from there, if there's still participants that are going through eligibility, go through eligibility, and then go through the rest of the things. But newly signed informed consent, adverse events, and action items from the previous visit, those are the first things that you need to look at when you get to site, and then the rest of the things would be building up based on those things. But yeah, I always look at those first, and yeah, move on to other things. But we all set up our visits differently. Don't worry, you'll get the hang of how to set up a visit.